This week on Healthy Living, what is hepatitis and are you at risk? We'll have some answers. Health officials in Cameroon step up efforts to lower the incidence of hepatitis in the country. And experts warn that Somalia is on the cusp of a famine. Plus, a Mozambican artist brings his paintings to life with his feet. These stories and more in this edition of Healthy Living. Hello, I'm Lina Ahmoudou. Thank you for joining us on Healthy Living. The liver is a key organ that processes nutrients, filters blood, and fights infections. Its function can be affected when it becomes inflamed or injured. Hepatitis is an inflammation of the liver. The disease can be caused by several viruses called viral hepatitis, by alcohol consumption, some medications, and several health conditions. Chronic viral hepatitis affects over 70 million people in Africa, according to the World Health Organization. There are 5 main strains of the hepatitis virus, types A, B, C, D, and E. WHO says about 354 million people worldwide live with hepatitis B or C, and they are the most common cause of liver cirrhosis, liver cancer, and viral hepatitis-related death. Cameroon is among the African countries most affected by viral hepatitis B, with a prevalence of 8.3%. The disease wreaks more havoc in rural areas. Health authorities in the country have launched a national plan to fight the disease last year. Emmanuel Gillenstab tells us more.
In Cameroon, hepatitis B infection rates range from about 6% to 16%, with the highest rates in the far north and northern regions of the country, according to research published in the National Library of Medicine.
According
to programmatic data and certain studies that have been anticipated, there is an increase in the incidence of viral hepatitis B disease overall, and in particular in certain target populations, such as pregnant women.
A trend that is confirmed in health facilities where screening is offered. In this private hospital, screening costs 6,000 CFA francs, and you have the results within 30 minutes.
There are numerous modes of transmission. There is maternal-fetal transmission. There is parenteral transmission. We are talking about contamination through the blood by a person already suffering from hepatitis B, soiled objects too, and even through breastfeeding. Apart from those, we now find other modes, and we focus on sexual practices, which prevented the appearances of new variants.
However, studies show hepatitis B can be transmitted by any biological fluid, such as saliva, sperm, and sweat, a complex disease that has led Cameroon to adopt a national strategic plan to fight against it.
We do a lot of advocacy with political decision makers in the fight against hepatitis through the organization of mass screening and awareness campaigns. We have also issued the integration of vaccination at birth against viral hepatitis B systematically in the vaccination record. We are in the process of submitting this file to the state so that next year or the following year, the introduction of this vaccination can be implemented at birth.
The government encourages patients to go to one of the 19 hepatitis B care centers created throughout the country. In Yaoundé, only 3 centers out of the 6 in the capital are operational right now.
Screening for viral hepatitis B is part of the minimum package to be given to basic pregnant women. The treatment, tenofovir, is up to 2,000 francs per box, and vaccination is not yet subsidized.
According to the Minister of Public Health, the decrease in the use of health services due to the COVID-19 pandemic has also contributed to the increased rate of hepatitis B infections in Cameroon.
Dr. Swaleh Pazi Kitabu is the head of the diseases unit of the digestive system and liver at Muhimbili National Hospital in Dar es Salaam, Tanzania. He tells us more about hepatitis.
The issue is not the trend is increasing, but the diagnostic criteria or diagnostic model has been improved in such a way that the number of cases now are well captured, and therefore we can say now the trend is increasing. still we have some patients, and this is a large group of patients who are not aware that they have hepatitis B infection. More than 600,000 people are dying every year because of chronic hepatitis B related disease. About 300 million people who are living with hepatitis B infections. So people should be informed of these facts so that they can be aware about the importance of screening. Of course, access of screening is also a challenging in our setting because this is a screening test which mainly available in town, but in villages it will be difficult. A good thing is development of vaccinations. So any children which are born have to be vaccinated. Another development which we have is availability of hepatitis B vaccine to elderly. Those are adult patients who are hepatitis B negative. This is a very important measure. It's also a very important part in prevention. Government and the other stakeholders should make sure that should invest in the prevention of hepatitis B infection from mother to child by making sure they provide access of vaccination to all people, especially those people who are hepatitis B positive pregnant mother. They deliver children which are hepatitis B negative should be vaccinated post-delivery immediately. My cry to government, African government, and the whole continent is to emphasize and to make the strategy in the prevention in these areas, so that to cut off the route of transmission of hepatitis B from mother to child, and therefore to the rest of the population. And government should also invest in the education of screening to those people who are elderly patients. It will prevent the complications of chronic hepatitis B infection. If a patient or someone who is not aware with chronic hepatitis B infection can end up with the deadly hepatocellular carcinoma. So when you screen and then you treat or make follow-up to those patients, it minimizes development of hepatocellular carcinoma to be life-threatening condition in our patients.
Experts say poor rainy seasons, widespread conflict, and the impact of war in Ukraine are pushing millions of people in Africa into food insecurity. Cereals and fodder are lacking in some countries, also affected by climate change. What are your thoughts on the ongoing crisis of food insecurity in Africa and how to address it? Here are some reactions on Facebook. Saad Ibrahim Bari says, food insecurity in Africa is due to endogenous factors. The crisis existed long before the war in Ukraine. The solution of food insecurity in Africa must be political, economic, and climatic. Alphonse Mbwaki writes, to solve the problem of food insecurity, let's change our eating habits, prioritize and consume locally grown products. This will give us food independence and save us from external imports. Instead of wheat, we can grow cassava flour, corn, rice, and make bread from these crops. Banadir Hospital in Mogadishu is overflowing with parents very worried about their malnourished children. It has been 4 months of no rain in Somalia, Kenya, and Ethiopia, causing what meteorologists and climate scientists are saying is the worst drought in over 40 years. UN aid agencies and meteorologists warn that Somalia was on the cusp of a famine. Here is more.
Banadir Hospital is well past capacity, and not with patients infected with the virus, but instead with children suffering from malnutrition.
We are receiving patients 3 times more than the number we used to receive before. We sometimes experience shortage of beds due to the increasing number of patients coming following the droughts. The hospital needs to be improved in terms of bed capacity, and there is a need for mothers to be provided with nutritious meals.
Experts have been warning of the threat of famine in the Horn of Africa due to drought, and a spokesperson for the World Meteorological Organization says there's a projection of another failed rainy season ahead.
4 consecutive rainy seasons have failed, which is a climatic event we haven't seen in at least 40 years. There is a very real risk that the October to December rainy season could also fail.
Without rain, the water sources and countries experiencing the drought, like Somalia and Ethiopia, have dried up, which affects farmers' ability to grow crops and keep livestock.
We had cows and goats, but they are all dying due to the drought and lack of water. We have been relying on food aid from the government during the past couple of months. My child is malnourished and she is swollen now.
Reports from the United Nations confirm this famine is worse than the one in 2011. Experts there note that in addition to the drought, the war in Ukraine has blocked supply lines for wheat. So they are projecting a 16% increase in the price of therapeutic food to treat childhood acute severe malnutrition.
My daughter is very sick. She was swollen when I brought her here, but the inflammation is now going down. I've never seen a devastating drought like this because there were no rains during the past 3 years.
Representatives from World Food Programme say the situation is only getting worse and that they are scaling up interventions, but will need over $200 million in funding to do so.
Nictar Benedito, a Mozambican artist from the city of Chimoio in Manica province, is a living example of overcoming courage and artistic creativity through the paintings he executes with his toes. In this report by André Batista, Benedito says that COVID-19 inspired him to paint the cry of the world due to the panic caused by the pandemic, which also resulted in an increase of early marriages in the African country.
Mozambican artist Nictar Benedito lives in Chimoio, a city in the central part of the country. Benedito paints with his toes because he was born with a disability that doesn't allow him to use his hands. He says that COVID-19 was the biggest obstacle he had to go through, and that inspired him to paint the cry of the world.
I have been painting what the world cried. When Corona started, the people in the village didn't understand what it was. These women carried everything and left the village because they thought COVID-19 was a spell. That's why they appear on their backs.
His art depicts first the panic caused by the pandemic and shows the social challenges specifically felt by women, like early marriage.
Here we see a beautiful but sad girl carrying a jar and a hoe very early in the day because she must go to work in the mashamba, in the farm, something she didn't want to do, but she is forced to do because she was married very young.
In January of this year, the police in Manica had said that child marriage had a surge in the province due to the COVID-19 pandemic, and that data from 2021, shared by the Mozambican authorities and UNICEF, revealed that 48% of girls aged 20 to 24 had been married before they were 18. Unable to showcase his art in exhibitions during the pandemic, the 37-year-old artist says he has been selling paintings to his friends. The amount does not always cover his most basic needs, so he says he relies on some government assistance.
For me, art is not about the money. Art is helping people to look at the world with different eyes.
Growing up, Nictar Benedito couldn't play with other kids, so to cope with his loneliness, he started painting with his feet on the floor. Now, he says he aspires to create a school where children with or without disabilities can gather to express themselves through art. This is what he says he wants his legacy to be.
I want to gather many children and teach art. Alone, I won't be able to do it, but if we get together, we will.
For more health news and wellness tips and medical breakthroughs, stay connected to Voice of America at voanews.com. You can follow me on Twitter at Linahmudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.